Mission. Thank you, Kiara and Patty, for being here. And happy White Cane Safety Day and week, everybody. And if you have never heard about White Cane Safety Day, we are here to talk about it, just White Cane Safety in general. So if you two can introduce yourselves and tell us about your position and what you do in that position here at CCVI.
Awesome. I'll start. My name's Patty Bushland. I'm a COMS certified orientation mobility specialist. I got my master's degree at TTU in Texas. Go Texas. And I just enjoying being here. I just moved from Austin to CCVI, so really happy to be here.
My name is Kiara Ohle. I'm the clinical social worker here at CCVI, and I'm also a registered play therapist.
All right, so we're talking a little bit about white canes in general, white cane safety, and Kiara, we're going to talk a little about play, since that's kind of your specialty. But before we get into any of that, Patty, can you tell us a little bit about what orientation and mobility is?
Sure.
What goes into it?
Yeah, I think it is challenging for some people to understand what actually is this person doing with my child, right? Mm-hmm. So a lot of parents. So orientation, that is where you are in your environment and where you want to go. So, say you just walked in the cafeteria and the food and the service line are all the way across the room at the opposite end. You might know, you need to know where you need to go, and you need to use clues and landmarks to get there. But first you have to orient yourself to the room. So that's your orientation piece. And then mobility is the piece where you need to physically get yourself from point A to point B. So, the safest, most efficient and effective way to get to that cafeteria line from the doors where you entered. So that's the orientation mobility. Yeah. So, and then orientation mobility specialist, or COMS, certified orientation mobility specialist. That's, the profession of teaching those skills.
That was a good example. I like the descriptiveness of it. It definitely puts it more in perspective for those who maybe have never heard about orientation.
Right. You might know that you need to get across that room, but there could be tables scattered all throughout. So the safest route might not be straightforward, right? So
how early do you start introducing that?
Kids when they're diagnosed and we know that they have a visual impairment. And we see that they're starting to move around and they've got some mobility skills and they're, exploring their environment. That's a great time to get started with a cane. So.
All right. And then Kiara, you're a clinical social worker.
Yes.
I'll just say clinical social worker. So what exactly is that? What was your schooling like? And, I feel like most of the time people, when they think of social worker, they just think of a social worker, but that's not exactly, I would say, all that you do, especially here at CCVI. So what does your job entail, especially being here at CCVI?
Yeah, I like to make that distinction, mainly just so the people that I engage with, especially our clients, our families, know that I come with a clinical lens, that meaning counseling. So in social work, you a lot of times think maybe of a social worker as somebody who does those case management skills, and those are definitely really important to our families, and I do serve in that capacity here at CCVI because we want to make sure those basic needs are met. If that is food, utilities, clothing, access to some of the different devices that come with the kiddos we serve that have medical complexities. So those kinds of rights that families have, we want to make sure we get met with those case management needs. But as a clinical social worker, you can advance your schooling to go to school to become a therapist, so to say. And so I have that title and those credentials, and have also pursued the play therapy route as well. And so here at CCVI, it's fun, I think, because I kind of come with a wide range of skill sets, and this position being something that's still being developed. It's just really fun. My day-to-day looks very different. I'm a Missouri First Steps provider, so I can go into the homes and clinically, so within the therapy position, support the whole family system. So that might mean doing some work with a parent individually on parenting reactivity, maybe grief work, supporting them with coping skills. It could also be doing some work with them and their kiddo together. So doing some of those attachment pieces that can happen, and supporting the whole family as a whole. For our school-based program we have at CCVI. I go into the classrooms and I support teachers with some of those triggering behaviors that our kiddos can have, or challenges that our kiddos have, and how to really create a team approach to how to best serve our kiddos with the challenges that they have and giving them experiences. So it's a wide variety. It looks different each day, but it's really, really fun. And so, it continues to evolve.
We love that, though. We're glad that you are here and offering your expertise, especially since you have such a wide expertise that kind of fits very well with CCVI. And you mentioned play therapy, which we are going to dive into later. But before that, I kind of wanted to talk about White Cane Safety Day and what exactly that is, because that's the big subject for today. White canes in general. But Patty, so you came from Texas, and I know that they had a really big White Cane Safety Day celebration there. But can you tell us a little bit about that, but just what White Cane Safety Day is in general?
Yeah, well, first I want to say that it got started October 15th, 1964, when President Lyndon B. Johnson signed a proclamation, right? I mean, a lot of words there, but that's how October 15th became National White Cane Safety Day. And so around the nation, we celebrate it, different schools celebrate it that week throughout the nation. And when they passed that law, it's about the nation recognizing that the white cane is a tool that people with visual impairments use, and that is nationally recognized as a tool of safety, and that they have the right to have this tool with them wherever they go. And that, it also means that they have the ability to, live a full and independent life, and that they also can and should have access to jobs, competitive jobs. And so that's where it all got started. And then as we, kind of progress, it just makes sense. It's about inclusion, awareness, the sense of community for our community, for people with visual impairments, right? So that was my favorite part about these celebrations over the years, is that our students don't feel alone. They realize there's a bigger population. There's adults out there living active, happy, full lives, and they're blind as well. And so, just the idea of families getting together and supporting and empowering this, the students and their children, and the extended families getting together and saying, yeah, your tool is cool.
I like that.
So,
put that on a shirt.
And it's important, and so we want them to know that how important it is. So, So these celebrations are a big deal, and then creating awareness in the public. So anytime we can do that, both in the immediate school community and then out in the larger community, is very important. So.
No, for sure. Especially for those who don't really know that much. I think the long white cane is a symbol. People recognize it, and instantly people are like, oh, that person's blind. But that's about it. People don't feel like they don't know too much more about it in that sense. And also just I feel like most people see someone with a cane and think, oh, they can't see anything. It's completely out, which isn't completely true.
No.
But and we kind of talked about it, but we kind of talked about it. You introduce the white cane to kids, basically as soon as they get the diagnosis, as soon as they can. But there's a variety of canes. Since we're kind of talking about white cane safety, what are those different canes? What do those look like for maybe different kids? Someone who's a toddler and just learning to walk, or maybe an adult, or even maybe a little kid who has more of a struggle walking in general, maybe due to another disability or something like that.
Sure. Well, and so some children receive a diagnosis at birth. So there could be where at some point in their toddler years, you're just introducing it to them. They're just exploring, feeling things, and it's not like they're actually out there getting lessons on how to use it, but just that this is something that they can explore. That is going to be something in their future. And then, as they get older, and we said that once they start moving around and exploring, and, if they're, on their feet, yes, we can definitely get it in their hands and start working on some of those skills. preview devices can be like AMDs, where it's not your typical white cane, but it's more of a push, almost like a push toy, but a push device. And for them to just start learning where, if that push device finds something, okay, what is it? We walk up to it, we explore it. So very simple, at the beginning, and then we move on. And when we see that they have the strength to even hold a cane in their hand, that's when we kind of progress. So, just moving that along skill wise, and then eventually they'll get up to crossing busy streets.
That's really good though, and the importance of canes, independence, and everything like that. And I think you brought out some like interesting points about just introducing the cane, like a kid literally feeling it, figuring out like what is this thing before you really get into using a white cane, orientating your body and everything like that. So I feel like that's a really good segue to kind of talk about like this toy white cane. Like that's, some people may have seen our like DIY how to make a toy white cane, but it kind of, when Patty got here, it brought up an interesting question of like, well, a white cane is not a toy, but this kind of is a toy for your toys and everything. So I kind of want to dive into that. And when, for these toy white canes, when would you say the best time is to introduce it to a child? Because of course you don't want to introduce it to a kid like as they're learning about their own cane, because then it's like, oh, these are both toys, I can play with both of these. So what are your thoughts on that? And kind of I'll let you guys kind of go back and forth and talk about that.
Me and Kiara were having a little bit of a discussion about that, and there's a couple ways you can look at it. It can be an adjustment and overwhelming for the whole family to take that step where the child needs a white cane. So maybe even introducing the toy white cane, pretend with some of their toys, the white cane that's a toy for their toys, right?
It becomes really tricky.
So, then it's kind of a nice segue to actually introducing the white cane that they will be using for navigation and for safety. So you had some good points too about.
Really looking at, I like the creating a toy white cane together as a family. So it can be something that Patty and I talked about before, where even the concept itself might be something that the whole family system is getting used to. So creating a toy together that creates ownership for a sibling to learn more about their sibling that is going to be at some point utilizing a cane, a white cane, to navigate their space, but then also for that child themselves who will be using a white cane to orient themselves. It takes a lot of ownership, and it becomes an extension of themselves. They become very attached to this white cane because it gives them a sense of safety and a sense of empowerment. And so creating that together as a family, talking about the parts of the cane, talking about why this is important, talking about why maybe it's not seen as much outside of here. I think that's one thing that we as an agency, we try to do a lot of advocacy about is creating inclusion and equity, right? So making things accessible, noticeable, even not just for the families that go through it, but also the importance of having a white toy accessible to families that might not see that in their everyday life. But we want to create a world in which kiddos and families start learning about other people and how other people live. And that starts with toys. That starts for our little minds.
Even be some of that role playing with, how is the right way to use it, and, So.
Yeah, and the beauty of using it too in those safe spaces, right? When we're introducing something like this that is a toy, so doing it at home, or maybe the tool itself as a white cane is not used to navigate themselves because they are familiar with that environment, using that opportunity to, as a family, come together and have an exploration with a white toy cane to take that ownership and to kind of learn about the different parts and do some pretend play. And
then we said then it would be very separate from when they would actually be learning how to use the cane and working on those skills, those cane skills. It would be separate time.
Yeah.
So I think that's very important, and I think it can only help them with their self-confidence and empower them. It's true.
Yeah, I feel like a lot of kids, we have to learn how to differentiate between what is a toy or what's maybe a real tool. For our kiddos that have visual impairments, we do utilize, Patty and I had talked about this too, we utilize a lot of real life examples to give them play experiences with real life examples. That might be a real whisk or a real plate. So that way there's more of that tactile exploration too, if there's limited vision or no vision at all accessible to our kiddos. So really being able to learn that skill of differentiating when is it playtime and when is it time to engage in everyday kind of life skills of feeding themselves or orienting themselves to space and safety. So differentiating and learning that skill of differentiating when it's play and when it's pretend play, we kind of try to differentiate it that way, and when it's kind of time to move around the world with everyday tasks is a really, really important skill for our kiddos.
And they just introduced the Barbie the Barbie with the white cane, and that was received very energetically by the community of visual impairments, and so many young children were ecstatic over this, and they were felt that now they were included in this play with Barbie dolls, right? So
it speaks to
representation.
Yes, exactly. I was just going to use that word, like the power of being represented and seeing yourself outside of yourself, and like what that can do for someone to feel seen and valued and a part of society.
Absolutely.
Do you think, having a white cane in general, but also like having that white cane as a toy for your toys, do you think that helps like kids with their own self-advocacy toys, or not toys, their own self-advocacy skills, like maybe playing it through their toys, whatever that may be? They have a baby doll, look at my white cane. They're going down the street, they're playing out like what they've lived. Do you think that really helps like elevate their self-confidence and their self-advocacy skills, and like essentially like later down the road being proud of who you are, because like I've had these toys forever, my friends have these, everyone knows.
And I think other kids would be very interested in it and might ask them questions about the toy they're playing with versus when they have a cane. What's that? So it could already introduce it through the doll. So, but definitely self-advocacy. As O&M specialists, we are always working on that with our students. It's a lifelong thing that we continue to want to work on with them. Problem-solving skills. If they get lost ever, they need to be able to reach out and self-advocate about requesting for help. So, anything that can build those self-confidence skills and empower them to then self-advocate in the future, absolutely, it's a win.
Yeah, and from a play therapist perspective, I have had the privilege of being here and seeing Patty and other O&M specialists work with kiddos in the hall. And one thing we see quite a bit as you're learning to utilize a new tool, that could be any sort of tool, there's frustration with that, right? We as humans have all experienced that. If that is a drill or a hammer or whatever, there's frustration, right? And so this white cane is another tool, and kiddos will have frustrating elements. They're learning how to navigate a world that can be pretty frightening at times because things just come at them. And so having that ability to have a toy that's a stuffed animal or a baby doll and playing out those frightening experiences in a safe place, at home perhaps, or in another setting that feels safe, like a classroom or something like that, where that frustration is a place that they can displace on something else, is really where some of that learning and some of that release of the pent-up anxiety or distress can come from for kiddos that are learning how to navigate this world that is not always made for them. And so I think it's really, really helpful to have these tools accessible to kiddos so they also get to express and tell their story of what it's like to learn this new skill.
Yeah, that's you hit it on the head.
Okay, we're done. That was it. That was good. Oh my gosh.
Yeah.
Well, you guys kind of touched on it before about kind of like translating the skills that they learn as O&M, like labeling parts of the cane into their play. And do you think that's like a common area, like where play in maybe like an O&M lesson or session overlaps and can come together, like with this toy cane, like with a teddy bear or a doll or something like that? Like those more like hard skills, not exactly like as much soft skills, I guess.
we always want to find things that motivate our students to learn, right? And so it's, you might catch us playing red light, green light out in the hall for stop go, right? And then just learning, what are other kids, typical kids like, in the community playing as well. So, they might not have any vision, but to learn red means stop and green means go. We can still teach those things. Scavenger hunts with, students like scavenger hunts, then, kind of to find different textures on the ground. So we are always, that's one of our teaching strategies to find out what motivates them and then make learning fun. So I think this is right along those lines.
Yeah.
So.
Yeah, we've had an opportunity. We've had a kiddo in the classroom who struggles at times with transitions. And he was having an O&M lesson with another provider here, and was just very dysregulated, not wanting to follow just directions. He has a difficulty communicating verbally, so a lot of his communication is through behaviors. And so with me kind of just walking the hallway, I noticed this and was signaling to the O&M if they're needing some extra support, and they actually did want some. So we ended up coming up with a plan together of having his stuffed animal that he always carries with him throughout the hallways when he's doing things, that stuffed animal having a toy cane and him having a toy cane. And we just did 2 more minutes of O&M lesson so we could kind of end on a positive note. And that really helped him kind of get back to the goal that was directed and kind of like set for them together as a team. But then also kind of getting that relief of being able to go where he wanted to go, which was to recess. Like a lot of our kids want to go, right? So it was a really nice way to kind of help him be interested, right? We look at motivations for our kiddos, whether like you had touched on that, Patty, of like what are their motivators? And it's like, okay, maybe I can like meet them halfway, and like I know this stuffed animal is really important to him. Let's give that stuffed animal a toy, and then kind of like navigate him. Keeps using his toy, he's teaching that stuffed animal, and then being able to go where he wants to go. So that was like another example that we've had an opportunity to kind of practice here at CCVI, which was kind of unique.
It's so valuable to have you just even like observing in the halls and picking those things out.
That's wonderful. Thank you.
I like that. And so I'm trying to think of like being at home, families at home, working on just cane skills in general with their child, orientation, mobility after hours, going to bed, going to dinner, whatever it may be. But then also playing at home. Where do you think like the biggest, like some of the biggest tips you could give to parents, whether it is focusing on like a child's orientation, mobility skills, or play with a toy cane with toys and everything like that? Like what would you advise parents to do? Is it, introducing it into like a safe space where they don't use their cane as much? Is it, working with your cane and playing with the toy at the same time? What are your thoughts on that?
I really like the idea of it's, separate from, where they would be using their cane as a tool and for safety. So I agree with what you had put out with regarding that. My biggest advice to parents regarding orientation mobility at home for their kids is just let them explore, let them go the wrong way and problem solve and figure it out. I feel like so many times parents and family members, do you just want to be helpful and give them verbal cues or guide them or, grab them? No, you want to let them explore their environment, create a mental map of them, for themselves, and then teach them that advocacy. When do they, ask for help when you need help. Let them explore. If they, you see that they're, having challenges, then jump in and say, oh, did you need to ask me something, but that's just kind of what I wanted to put out there. I know it, and maybe we can role play it with the dolls at some point or something like that, right? But,
I'm so glad you bring up the frustration tolerance piece too, of just like letting kiddos, sometimes it can be, right, our own needs as adults or parents can kind of, caregivers can come up of like, oh, I want to rescue them out of the situation, but sometimes we take an experience away from them where they really get to problem solve something. And so I love that you brought that up, because because I think that's so important if that's any type of play or any type of real life situation, because you're letting them problem solve on their own, which makes them feel empowered that they are able to solve their own problems, with the support of you still being present there. So you're still an active participant as an adult, but they're coming to that conclusion on their own. One thing that I do want to revisit, because I feel like I didn't make it as clear, is the example with the hallway at CCVI. We want to make sure we are always making sure kiddos are safe, right? So utilizing toys and canes together, doing that in spaces where safety is considered. So correct me, if you have a different
Safety
perspective
first.
on this.
Yes.
But like being outside might not be the greatest place to kind of use a play toy cane and a white cane as a tool, because there's safety pieces there that kind of take precedence, which we really want them to use their tools. And sometimes toys can kind of, they're novel, they're fun, they're exciting, so they can kind of take the motivation or shift the motivation for a child. So just kind of being mindful of that. And so I just wanted to revisit my example I gave earlier of like, we were using the toy and the cane together in the hallway because it was a safe, familiar environment for our kiddos, because some of those kiddos have been going here for a while.
And it just brings up the point, like a lot, when our kids are learning a route and they're traveling, we don't really want them to have other things in their hands. We want them focused on the route and not distracted. So.
Yeah, very like, this is what we're doing right now. Remind me your question.
That was basically. Like tips, advice for like parents at home using like owning skills and like a toy white cane, like what that looks like at home. But I mean, safety first, of course. I love that.
I think too. There's with the kit, we have some some tips on how they can role play with the child that has the toy, the white cane that's a toy, right? So I loved that. That was a really fun piece that I would have appreciated having when my little girl was little. So
So different ways that can look. We have something called more adult-led play, which is where the adult kind of sets the agenda for the play session. It might be a specific directive like, let's practice with your baby doll and the baby doll's white cane of how to go to school, right? And so you might have a school bus and a baby doll there, and you're kind of setting the scene, so to say. So that would be adult-led play because you're leading the play, right? You're setting the intention of what you would like your child to play out. And they will take it wherever they take it from there. But another way to do that too is child-led play. And that might just be that the toy cane is actually available, right? It's actually part of their play box, part of their playroom if they have that at home, or just where they keep their toys. And so that's really where the child has the opportunity to, without the setting of the scene, look at what do they want to process, because they might actually want to come home and just use their baby dolls and their stuffed animals or little figurines and process what they learned with Patty today, and just kind of play out their day. And in that playing out their day also comes up the session that they had with Patty. So there's different ways to go about that, and so there's more of those times when you set an intention of let's play this out, or maybe it could be yesterday it was really difficult. Remember when we went to go get ice cream or went to the park and this thing happened. Maybe it was a little icky, or maybe they bumped into something. Maybe we can teach your baby doll, or tell your baby doll about what happened, and using that cane. So you're kind of once again doing adult-led play, but you're kind of setting the scene, but also giving them an opportunity to say, hey, it's okay to play this through. We want to hear your story. Your toys are here to listen to you. I'm here to listen to you. And they're getting that out of their system.
Yeah. That's wonderful. I like it. The one thing I really wanted to talk about and touch on was like representation. We kind of already touched on that, and how, especially, Barbie was a great example. Barbie is such a huge toy. It's been around for a while and has totally evolved throughout the years and everything. So it's very iconic, and to have a Barbie doll who is blind, who visually looks blind or something like that, and then has the toy white cane and everything like that. I feel like that's a huge thing in the community, blind and visually impaired community, to have that representation. But even just on a smaller scale with this toy white cane, how do you think that kind of plays in with the representation of the blind and visually impaired community and kind of like, you know, helps a child feel represented, I guess.
Yeah, I mean, where the idea of the do-it-yourself toy cane idea came from is because I was trying to look at toys that were accessible for our kiddos here at our center, or that we're serving, and it is hard to find toys that kind of so distinctly represent the items that our kiddos come in contact with every day. And a lot of times when you do find those toys, they come with a hefty price tag. So, right, when we're talking about access, that's something that's not accessible to everybody, or you don't see it in an everyday store. Yeah. And so kind of thinking about, it's great that these things are starting to emerge to come out there, but they're still specialty items or so labeled as specialty items. So the idea of it really being a do-it-yourself, like, it's like you might have some of these things at home, some of these, you know, a dowel, some paint, some duct tape, and you can create some of these toys for your kiddos because they deserve that. And so we really wanted to make sure that we also create toys that are accessible and that come with an accessible price tag. So one thing that we have been working on too is for White Cane Safety Day is putting together do-it-yourself kits for families to take home, so they can start to actually start, you know, this process at home, and hopefully that will spark some ideas of like, let's do this in our other pockets of communities that we have, maybe with grandparents or maybe with, you know, other support systems that they have with friends and such. So it really is to kind of create, just access in a very simple way.
I just want to those real life experiences are so huge. That's like the best thing we can give for our kids. So like giving families an experience that they can have with their siblings and their caregivers and bringing that home to them. It's just, that's what they need. That's perfect. Yeah.
Mm-hmm.
Well, I've loved hearing you guys talk about both your perspectives on like white canes and play and just representation in general for kids, especially young kids who do need to see this and who need to experience it now versus never experience it until they're later. I feel like that definitely has a huge impact on a child. But before we wrap up, do you guys have any closing remarks you'd really like to just get out there to like parents, caregivers, school districts, anybody who's just interested in white canes or play or something like that?
I would just say, like, if there is a need, to see if you can bridge it.
Nice.
You know, like if there's something, and that is so overarching to a lot of things, but I think we all from different perspectives know that things are progressing in ways, but there's still a lot of needs that are not met. And so if you see something, do something.
Yeah. I just love keep creating awareness, you know, just this doll being out there, somebody seeing the cane, you know, asking about it, that's creating awareness. But, you know, showing your child and, you know, other people who have visual impairments are out there in the community having active lives, you know, they have jobs, they're performing, they're acting, all these wonderful things. Just it's going to be so empowering for your child. So keep showing them that.
Gosh, well, thank you guys for joining me. I love hearing about everything you guys have talked about, and you guys are both clearly passionate about this, which makes it even better. And I hope everyone who is listening or watching has enjoyed this podcast today with our amazing clinical social worker and amazing O&M. And happy White Cane Safety Day.
Happy White Cane Safety Day.